Hi, I'm Michelle Garden. I'm the clinic director here at One Stop Clinic at the Bill Gavano Turning Points. Welcome and thank you for watching this segment. I'd like to tell you a little bit about our center, what we do here in the clinic. We are a training facility for LECOM medical students and pharmacy students, along with attendings that help train and educate these students to go on to be physicians. We're also part of the Manatee Memorial's residency program, in which the residents come in along with their attendings. What we do here is provide free medical and dental services to the working poor and to the homeless. We do this with a myriad of different services that I will illustrate shortly. But I'd like to explain just what is the working poor. One typical example is a husband and wife. The wife has seizure disorder and the husband has high blood pressure. While we manage their treatment long-term, educate them on this treatment and how to best manage these chronic disease states, and also keep them in prescriptions. We also help in vouchering or find medication assistance for them to keep them out of the hospitals, out of the emergency rooms, and to help keep them working and raising their family. That is just one of many typical examples of the working poor. We appreciate all your help, and please vote yes on June 18th. And now I'd like to illustrate all the different services that we offer here at the One Stop Clinic. We have minor procedure room. We offer joint injections for pain and inflammation, incision and drainage, suture removal, cyst removal, skin biopsies, and many other variety of minor procedures that we do here. We offer a foot care program here. It begins with a weekly nurse practitioner who comes in and examines the feet, does some foot soakings and examinations. She goes on from there. If she finds anything wrong, refers to the physician on site here, which the med students or the residents takes over. If they need further examination by a podiatrist, we do have a podiatrist that comes into this clinic once a month. We also partner with East Manatee Rural Health to their podiatry system as well. We also offer women's services such as pap smears, pregnancy tests, and breast examinations. It's very important for women's health that they have these checkups, especially for those who do not have insurance. These are not typical examinations that they would seek out. It's vital that we stay here and that we're able to continue to offer these very important services. We're a wound care center also for the working poor and the homeless. Both hospitals send their indigent patients over here to us for follow-up care, as well as any walk-ins or appointments or from any minor procedure. We tend to all their wounds, incisions, and dressing changes. Hi, Dr. Vasquez. I know you're a pharmacist with LECOM. Can you tell me about the many services you do here with your pharmacy students?
So we provide a number of services here. Probably first and foremost, what we do here is we try to provide free medication for the number of patients that we have here. Also, through collaborative practice with the patients here, we try to provide primary care services for the patients. So collaborating with the physicians, we manage their primary diseases, diabetes, anticoagulation, cholesterol. We try to manage their drug-heavy diseases with the physicians.
Thank you for that. So in other words, you manage their chronic diseases, diabetes, hypertension. You offer a Coumadin clinic here in which you do weekly or as necessary PT/INR checks so that they can manage the level of their Coumadin they take. Is that correct?
Yes, working directly with the physicians, working hand in hand with the physicians here, we try to manage the diseases very in depth with the physicians to provide the best care for the patients.
And I know you also offer a lot of education on these chronic disease states. Is that right?
Yes, with the patients, we try to educate them so that they can take hold of their diseases, to make sure that the patients can get a grasp on their diseases and ensure that when they go home, they have a great understanding of their diseases to ensure that they can battle them and really, hopefully, over time, really get better and hopefully, over the long run, really get a better control over their diseases and get better over the long run.
And that's correct. In their understanding and that their input and their own control over these chronic disease states, they can better control these and stay out of crisis and manage these along with your education and knowledge that they can too be a part of their own well-being instead of relying solely on another person. My understanding too is that you work very heavily with your pharmacy students. You teach them how to write prescriptions, the questions to ask, and how to evaluate our patients, right?
Absolutely. It really is a team-based clinic. We work with students, both pharmacy and medical, with the physicians, with the patient, so that the care of the patients is team-based, and everybody that is involved with the patient works to help make sure that everybody is involved in taking care of the patient.
Very good. A very, very important aspect of what you do is a smoking cessation program. That's wonderful. I know you have a very good success rate with that. If you could elaborate on that. And I also know that you address any alcohol issues.
We do. We have every 2 weeks we have a smoking cessation class. It is a group class funded through the AHEC program in the area. After the group class, we have individual sessions that is run by the students through my overseeing, and working with the patients, we try to get them to quit. It's not easy, but we do have a pretty good success rate with the patients, and we through individualization of care, we work to try and help people quit smoking.
Yeah, that group and the individual counseling is very successful. It's what helps make this successful program. I know you also offer products for them for free.
We do. Once again, through the AHEC program and through other patient assistance programs, we try to make sure that they can get all of their smoking cessation aids for free.
Like patches and the
gum, yes.
Yes. Thank you very much, Dr. Vasquez.
Sure.
I'm here with Kathy, one of our patients here at One Stop Clinic. Kathy, do you mind telling me how you came to the One Stop Clinic and what your experience has been like here?
Well, I came here in a complete foghead, confused state of mind. I didn't realize that I was literally dying. I mean, I couldn't even walk. I walked like a scarecrow. And I knew I was in bad shape by just seeing other people's expressions, including the doctors' mouths open wide when they laid eyes on me. They immediately started doing tests. They sent me to the hospital. And I'm a diabetic. They discovered that my kidneys are leaking protein, and that I was told I was not long from this world, and I get very emotional when I think about this place because of all the care that has been collaborated. It's not just one individual, it's everyone, the teamwork, and all the consideration and being treated like a real person and caring. People don't do but only what they want to do, and I know this so well. And when I see people spending time trying to teach me on what to do, how to do it, if I'm scared, I'm allowed to ask questions. I've been helped in every given area, Michelle. I truly feel, in spite of my serious condition, that it's nice to smile again. It's nice to feel like a human being and cared for. And it's just my experience with all I could say is that I was in very serious shape. I am very lucky to be alive. And it's only because of the clinic, you and everyone here.
Thank you very much, Kathy. I appreciate that. As you saw, we offer many and various different types of healthcare services for the working poor and the homeless. We also include among that our EKGs that we do here, spirometry, it's a lung function test, as well as medication management and prescription writing. We always have a physician on site, as well as students that they train of various different years, resident program under their attending physicians, and they offer all the regular health care, primary and long-term care, as well as a walk-in for any crisis of urgent need throughout the day. Thank you for your support.